to welcome Brianna Bonat, who joined the Virginia Cannabis Control Authority in June of 2022 and is currently serving as the Health Policy and Data Manager. In this role, Brianna directs administrative, analytical, and educational efforts to support the public health focus of the authority's mission. Prior to joining the CCA, Brianna worked on substance misuse prevention efforts at other Virginia agencies, including an internship and contract position at the Virginia Foundation for Healthy Youth, where she analyzed data from the agency's grant programs, and the Virginia Alcohol Beverage Control Authority, where her focus was on education and prevention program and training efforts. Brianna earned her bachelor's degree in kinesiology and health sciences from William and Mary, and her master's degree in public health from Virginia Commonwealth University. Following her presentation today, you will have time to ask questions. If you don't like to talk out loud, please feel free to send a question to either myself or Jenna. And Brianna, thank you so much for being here. I'm going to go ahead and turn the time over to you.
Thank you. I'm happy to be here today. Good afternoon, everyone. I am here to present on cannabis in the Commonwealth. We're going to go over some cannabis laws in Virginia, give you a brief overview of all of those. I'm going to talk about some data we have collected in-house at the CCA that might benefit you all. And then we'll talk about some ways in which we can work together on some CCA initiatives. Maybe we can help partner with you on initiatives you're doing as well. So thank you for being here. To start off, our mission statement, in case you're unfamiliar with the Cannabis Control Authority, we were established in 2021, so we are pretty new as a state agency, but we are an independent authority, we are apolitical, and we are a subdivision of the Commonwealth. And really, we're working to promote public safety, promote and advance public health, and protect communities in our state through our effective medical cannabis oversight and balanced and inclusive cannabis regulation, policy, and education, especially that education piece that is very important to us and what we'll be focusing on throughout this presentation. So again, looking at the CCA's roles, we regulate the medical cannabis program. We would also be regulating a retail marijuana adult use space if that is ever something that happens in the state. Currently, it is illegal to use. If you are not part of the medical program as an adult 21 and older. The policy advisor piece, we advise on policy issues. We're not the ones making the policies. So you can see on our asterisk here on the right, we are not making the laws. We are simply implementing policies that are established by our legislators. But we do advise on some of those policy manners in order to provide a public safety, public health perspective on some potential law changes. And we're an educator, so we are working to get information out there regarding the cannabis laws because they change constantly, it feels like. We're making sure people know the health risks of cannabis use as it becomes more legalized throughout our country and various states as well. And so that education piece is very key as we move on through different regulatory and legislative changes. So to get into cannabis laws in Virginia, first I want to start briefly just thinking of cannabis at large and the cannabis umbrella. So you often hear cannabis, marijuana, hemp, a lot of buzzwords that go into this one plant, but what is what, who's doing what, it is very confusing to the average person, and I get that. But if you think of cannabis at the top of the umbrella, you have marijuana, which is your like Delta 9 THC, which is going to fall under the CCA, under us to regulate, control, help promote public safety in that sphere. Then you also have your hemp products, which come from the cannabis plant. And so hemp products are used anywhere from industry. So hemp can be made into ropes, into body washes, into paper. And the hemp world falls under the Department of Agriculture. But at the same time, hemp products can be synthetically altered into the products you may hear about. So like Delta 8, Delta 10, THC-A and O, all of these are synthetically derived from hemp products in order to increase its THC content. All of those products are also regulated by the Department of Agriculture. So the CCA truly just has your traditional marijuana, THC, Delta 9, and every other product that comes from the cannabis plant is with the Department of Agriculture. As I said, the legislators' General Assembly, that is who you're going to seek out when you want policy changes, when laws change, when laws go into effect. All laws are created with our legislators and the General Assembly. And then in terms of enforcing day to day and those laws that the legislators do implement, you're going to turn to state and local police to help with the enforcement of those laws. So what is legal? And I'll go into all of these in a little bit more detail, but in general, I'm going to start off talking about medical cannabis. I'm going to move into discussion on our limited home cultivation that's legal. There's also limited possession and sharing, adult sharing, that is legal. Starting first with medical cannabis, anyone in the state of Virginia who meets basic qualifications and has been issued a written certification by a licensed practitioner can purchase cannabis products from a licensed dispensary. And so those basic qualifications are going to be that you are 18 and older, and do note it is 18 and older for this program. It's not 21 and older, but 18 and older, a resident of Virginia, and you have a condition that you and your practitioner think may be benefited from medical cannabis use. And so the process is that a person will reach out to a practitioner. That practitioner, if they decide that this person meets all those basic qualifications, will issue a written certification. And that written certification, which is kind of the equivalent of a prescription, but because cannabis is federally illegal, providers cannot issue prescriptions. They're noted as written certifications. So that written certification is then taken from the practitioner, and the patient will take that straight to a dispensary, and the dispensary pharmacist will work with that patient to find products that are right for them and their condition. And please note that the medical cannabis program is also interesting, unique in the sense that those under 18 can also participate with their parent legal guardian's approval. So a parent legal guardian can seek out a written certification on behalf of a minor or on the behalf of a vulnerable adult as well. This is an overview of our state and the locations of dispensaries and processing facilities. And so in general, we divide the state up into 5 health service areas. And you can see that the red dots here represent processor locations. So we have 4 processors in the state, 1 in each region. And there is one processor that is currently, one license that is currently not active in Health Service Area 1, which is that Northwest area. But each processor is vertically integrated, and so the facility or the company that owns that facility is in charge of cultivation, manufacture, processing, all the way down to dispensing. So there is a dispensing location on site at each processor location as well. And so in addition to our 4 processors in red, we have 19 other dispensaries that are spread across most of the state. But again, leaving that Northwest area vacant at the moment due to a lack of license. And we are in the middle of going through the process of getting a license there. We're in litigation with it. And the state organization that was in charge of this program before us, the Virginia Board of Pharmacy, they were also in a litigation period with a processor in that area. So the process to get a processor and dispensing facilities in that blue region is a slow one, to say the least, but one day we'll get there. Looking at home cultivation, an adult 21 or older can cultivate up to 4 plants in their primary private residence. So I say private because that is your home that you own versus the apartment that you rent. Your landlord may have different rules regarding the cultivation of marijuana in that space. And they, as a landlord, have the right to prevent tenants from being allowed to grow in their space. The plants must be properly labeled. So that includes your name, the note that you are growing this for personal use, not for anyone else, not to sell it for retail purposes. And you must also have a Virginia code section on that label as well. And it can't be visible from public areas. So note you can grow your plants indoors, outdoors, but I shouldn't be able to see your plant from the sidewalk if I'm walking by your home. And then you must prevent access by minors. And this is how it is written in legislation. There isn't any specificities as to how one prevents access by minors. So that is a little up to interpretation. And looking at limited possession and adult sharing, you have possession for personal use. So again, not sharing it out or selling it to other people. It has to be at your residence, and it's for adults 21 or older. So you can possess for personal use. If you cultivate at home and you produce X amount of cannabis, you can possess that in your home. But when it comes to public possession, it is only up to 1 ounce for adults 21 and older. And any amount above that faces various legal consequences, anywhere from a misdemeanor all the way up to a felony charge. I think that's at a pound or more. So in public, only up to 1 ounce. And then adults who are 21 and older can privately share up to 1 ounce of marijuana with other adults who are 21 and older. And that is without any compensation. So truly an A to B, no reversing that exchange. I hand someone who is also 21 and older up to 1 ounce and get nothing in return. And there's a lot of things that are illegal still, and this holds true. All of these hold true even after our legislative session, or after our legislative session that just happened. All of these laws are still relevant and still illegal. So when it comes to possession, again, if you intend to distribute marijuana, illegal. If you're under 21, it's illegal. When it comes to having cannabis, marijuana on your person at school grounds or school buses, illegal. And then, like I said, it is legal to have more than 1 ounce of cannabis on your person in public. Consumption, anyone under 21, not for them. But keep in mind, then we have our medical cannabis program that I just said was 18 and older. So this is for retail consumption, adult use consumption. So if you are under 21 and not part of the medical program, you cannot use or consume cannabis. You cannot consume or share cannabis in a public space. Any sharing has to happen privately. And then, as I said, landlords can prohibit tenants from growing or using cannabis in rental property spaces as well. No retail sales are happening in Virginia. outside of a medical cannabis program. You cannot give cannabis in exchange for something else. It's not a barter system, so I can't go to my local shop and ask for and purchase a sticker and in exchange get free marijuana. That is illegal. It truly is a one-time exchange of marijuana, and that goes for seeds as well. So you cannot go to a store, purchase a poster, and get seeds or starters for cannabis products for free, which then brings in sort of the dichotomy of our cannabis laws and how it's legal to grow up to 4 plants and home cultivate, but it's illegal to purchase seeds, purchase marijuana outside of the medical program. So in order for someone to home cultivate, they had to have obtained their seeds from somewhere down the line in an illegal manner, whether it was someone selling them seeds, ordering seeds online, or down the line, maybe they got them for free initially in a one-time exchange of sharing, but then that person who shared the seeds with them obtained them illegally. But there is sort of a balance and imbalance, I should say, in our cannabis laws, in which we allow some cannabis to be grown, to be possessed, but we don't allow for the sale of it. So, how are people obtaining it? And then when it comes to travel, you cannot operate a vehicle while cannabis impaired. That will lead to a DUI charge that is the same as alcohol's DUI charge. You cannot consume or possess an open container of cannabis while operating a motor vehicle. And unlike alcohol, where it only applies to the driver, this applies to both driver and any passengers. So no using any cannabis by anyone in a car while operating a motor vehicle. And then any mailing, shipping, traveling interstate with cannabis is also illegal. And that pulls in the relationship of state legalities versus federal shifts when it comes to cannabis legalization. So we have it where federally no cannabis is legal. Therefore, when you're using the mail system, when you're traveling on interstates, airspace, that is all federally owned. And that also applies to any like land that's federally owned. So we have our state of Virginia, but any national park land that's federally owned, cannabis is going to be illegal in those spaces. So anywhere where you have to use federal space, land, federal operations like our mail system, that is going to be illegal because federally cannabis use is illegal. Looking into some cannabis data. I'm going to show you give you like a brief overview of two more recent surveys that we've done. I think this first one will be a bit more interesting than the last, but I mean, I think it's all interesting because I work in data. So to talk about our impaired driving survey, our 2024 survey was our second version of our impaired driving survey. And so this was good because that gave us some comparison data versus the first survey we did in 2022 was truly just to establish a baseline. I think a lot of impaired driving data when it comes to cannabis, historically, we can't differentiate cannabis DUIs, cannabis arrests from other illicit drugs because often cannabis gets lumped in with other drugs historically. And so this, although it is survey participants and we're getting responses from from Virginians and their opinions as opposed to actual arrest data, for example, I do think it is a good telling on where cannabis use in driving is within our state. So for this survey, we had just under 800 Virginia residents that are ages 16 and older. So that is the driving age population with a driver's license. We partnered with SSRS, which is a research consulting company, and they handled our data collection and all the data analysis and reporting that went on behind it, behind the scenes. And then we made sure to weigh the data to be representative of Virginia's residents. So looking first here at general marijuana use, you can see that we've had an increase in marijuana use from 2022 to 2024. You can see about 60% of people said that they have ever used marijuana in 2024. So about 6 out of 10 people. And of those users, 1/3 of people said that they have used marijuana within the past week. So we have 1/3 of marijuana users using within the past week. At the same time, we have 39% of that 59 saying that the last time they used marijuana was over a year ago. And although we see an increase in those who have ever used marijuana, when we look at the data for the last time marijuana users have used marijuana, this data is pretty consistent with 2022 data. So the percentages haven't changed much there. In looking at locations of marijuana use in the past 3 months, compared to 2022 data, we had an increase in marijuana use at someone else's home, outdoor venues, clubs or bars, and at concerts. But at the same time, use at the own home, at someone's own home, has shown a slight decrease. So taking in this chart, we really wanted to look at where people are using and how often are people using outside of their own home, because anytime someone is using cannabis outside of their home is an opportunity to spread messaging and get people home safe. So spread messaging on what safe driving is and decrease cannabis impaired driving, but then also that puts people even more at risk for driving under the influence of cannabis if they're using outside of their own home. So you can see that 92% of people of past 3-month users said that they have used either at their house or someone else's house. But at the same time, you have about half of past 3-month users saying that they've used away from their home, with the most frequent location being an outdoor venue. So like an outdoor concert venue, for example. So when we're thinking of prevention strategies and meeting people where they are, on our end, we're especially thinking of where can we promote our messaging best? And perhaps it is at these outdoor venues or spaces where people are in their vehicles. So billboards, for example, where people are on the road. Clubs and bars. So how can we partner both locally and at the state level with local clubs and bars to help promote safe driving messaging? So this is very insightful to see where our cannabis users are using cannabis on a day-to-day. And then we also had 6 out of 10, so 60% past 3-month users say that they use away from their home at least once a week. So again, that shows just how frequently people are using outside of their homes, and gives us more opportunity to catch those people who are at risk of driving under the influence of cannabis. Looking at who our past 3-month users are, I'm showing just this chart to show a little geographic representation, but in general, our past 3-month users were significantly more likely to be younger. So think 16 to 34 age range. They're significantly more likely to be less educated and male as well. And we also have other demographics that we looked at in terms of statistical significance that are in the full report. But location-wise, you can see that our blue bar represents the total of past 3-month users, whereas the gray bar represents total Virginians. And so if we focus on Central Virginia, although in total, Central Virginia makes up 17% of Virginians, Central Virginia also makes up 19% of past 3-month users. So we're seeing that imbalance there. And then same thing with Eastern Virginia. Eastern Virginia represents about a quarter of the total Virginia population, but they're representing 30% of past 3-month users. And then on the flip side, you have the Northwest region where total Virginians, it represents 14% of Virginia's population, but only 12% of past 3-month users. Looking at perceptions of drivers, this statistic has stayed unchanged from 2022, and it is very concerning. It was concerning then, it's concerning now, but about 1/3 of Virginia drivers believe that those who consume marijuana are usually safer drivers who tend to drive slower and more cautiously. So that is 3 out of 10 people saying, and this is, again, Virginia drivers, not just marijuana users, but 3 out of 10 of all Virginia drivers are saying this. And that statistic is being pushed by our more frequent marijuana users, but still, it is very concerning. And looking at the frequency of driving under the influence of marijuana, you can see on the left, we have 2022 data, and on the right, there is 2024. And this is looking at our past 3-month users. So in 2022, we had 60% of marijuana drivers or marijuana users admit to driving under the influence of cannabis, and that has increased slightly to 65%. And what is more concerning, I think, is when we look at that blue bar on each side. So in 2022, we had about a quarter of people who were past 3-month users saying that they have used marijuana and driven under the influence at least once a week. And that has increased by almost 10% to 35% of past 3-month users driving under the influence of cannabis at least once a week. And then on the flip side, looking at our passenger seat and our passengers, you can still see that there is an increase in this behavior as well, and it is a risky one. But in 2022 on the left, 28% of total Virginians, so not just our past 3-month users, but all Virginia drivers, 28% admitted to being a passenger in a car, knowing that their driver was high or under the influence of marijuana versus 34% in 2024 said that they have been in a car with someone who is under the influence of marijuana. So we've seen an increase of 6% here. But on the flip side, we're seeing some positive change in our 2-year difference here. And so in 2024, we had 47% of past 3-month users who claim to always plan for a sober ride home. And that has increased from 42% in 2022. So we're seeing more people who are driving under the influence of marijuana, who are being a passenger in a car with someone under the influence. But we're also seeing more people who claim to always have a sober ride or plan to have a sober ride. At the same time, I do want to point us to the never side on the other end, where we still have 1 in 10 past 3-month users saying that they never plan for a sober ride home. So the goal is to obviously eliminate those who are never, rarely planning and get everyone to always plan for that ride. And here we've also seen some shift in a positive way. This is looking at perceived danger levels of various behaviors in driving. and comparing them, in our case, to marijuana. Um, so the marijuana use is increased, or the percent who have indicated that driving under the influence of driving after marijuana use as extremely dangerous is 34%. And this has increased from 26% in 2022. So we've seen a pretty good increase in those who are perceiving driving after marijuana use as extremely dangerous. Texting and driving remains the same percentage of extremely dangerous. It was 60% in 2022. It's 60% now. And these three remain, so texting and driving, illegal drugs, and driving after alcohol use, those remain the top three, consistent with 2022. And then you can see we have a pretty healthy drop off in perceived extreme danger level when it comes to marijuana and our other behaviors listed below. So that was just a brief insight into the impaired driving survey. That full report is available on our website in two different places, under our reports tab and under our safe driving page. There's also our 2022 data if you want to do any comparisons. And I oversee our data team, and we are happy to fulfill any data request if there is a specific target population you want to look at when it comes to this data, whether it's an age range, a geographic area. Please just let us know. We have a data request form and we can fulfill that data need for you. This is a brief insight into our program, our medical cannabis program patient satisfaction survey. I don't have too many slides on this because a lot of it is program specific, but I do think it provides some insight that might be interesting for you all to hear. And so this survey we did in the fall, and or I guess over the summer, and we published the information in the fall, but we worked with our dispensaries to help collect information on patients through patient participation in our survey. So the dispensaries, they distributed the survey for us. And the satisfaction survey captured different patterns of cannabis use in general, the process of obtaining a certification, purchase behaviors, dispensary experiences, and overall satisfaction. So I just have a few slides regarding cannabis use and some purchase behaviors. And the text has disappeared. Great. Um, but this is a pie chart that is showing, I really don't know where all the text went, but it's a pie chart showing the top medical conditions that patients have identified that they have in using medical cannabis for. So again, there aren't any specific requirements for medical conditions when it comes to Virginia's medical program. It is up to whether your practitioner thinks that your condition can be helped by medical cannabis. So we asked patients to report on which medical conditions they're using medical cannabis for. And so you can see our top three were anxiety, depression, and chronic pain. Looking at some medical cannabis use trends, nearly every patient, 98%, so all the way up to this yellow bar, indicated that they use medical cannabis weekly or more frequently. And we had 81% of patients say that they use medical cannabis daily. And I wanted to show this and highlight this because even though the medical population isn't anywhere near the total population of Virginia, I do think it shows that if people are using medical cannabis every day or at least weekly, most people, which I think makes sense if you're using it as a medication, because I mean, I have daily medications, right? But people who are using medical cannabis daily, weekly, also need to be aware of not only the health risks, but going back to that safe driving information that they should not be driving under the influence of cannabis. And so medical cannabis, just like your retail cannabis, would still impact your driving, and it's still going to impact the way you operate and function with motor vehicles, as well as your daily operations. And in looking at our primary source for cannabis under medical patients, 80% of participants said that they do use Virginia's medical cannabis dispensary as their primary source. So that is not factoring in every other source they use, but 80% are using it as primary. At the same time, that means we have 20% of medical cannabis patients, and this population, for context, is about 100,000 patients, give or take, in the state. But that means we have 20% of patients who aren't using the program as their everyday source or their primary source. And so then the question becomes, well, where are they turning to, and how can we make sure that the other source that they're turning to is safe and tested and legal? So our top reasons for participants not using the medical dispensary, the big one is cost, and lack of diverse products comes in second there. So the medical cannabis program is known to be pricey among patients, and so they do turn to other sources such as the unregulated market because they can get products for cheaper. But at the same time, the public safety, public health concern, like I said, is whether or not that product that they're buying illegally is tested, is safe, is legal, which it's not. So um, those are items that we're trying to focus on too, is how do we reach that 20% to make sure that if they are going to use cannabis, they're doing it in a safe and legal way. If you are interested in the patient survey in more details, we do have that information on our website as well under our reports tab. To move briefly into educational resources, shifting gears a bit in tone, but these are our, in general, educational initiatives. Data collection is a big thing we're focusing on, especially as a new state agency, building up our database so that we can use it to inform ourselves and others. Educational resources, our safe driving campaign, and then partnerships and outreach. So briefly on data collection, as the CCA and being new, we are making sure that we are collecting data on internal measures that focus on how can we operate efficiently and effectively. We're also collecting information on our medical cannabis program, so making sure that we have information that we need to improve the program, better the program. That includes our patient survey that we just did. We're in the middle of analyzing a practitioner survey to see how the program looks from a practitioner perspective. And we will also have some information coming in from a new seed to sale program, which that software will help us track from a public safety perspective, a cannabis plant from truly its seed to sale, to the point of sale. So we can monitor any health concerns with a certain marijuana strain. It'll also give us important data on purchasing and consumer behavior as well. And then general public health and safety, we're not the only data source out there. We're also making sure that we keep up with national, state, local cannabis-related data as well. And looking at our educational resources very briefly, we have so many educational resources that we have produced because education is something we've been prioritizing, especially during the period when we were not the regulator of the medical cannabis program. Therefore, our big focus had to be education. So we have fact sheets on cannabis laws in Virginia. We have toolkits and fact sheets on health risk, and you can find a toolkit on that focuses on youth. You can find one for parents as well. So we have different audiences out there. And then if you are looking more into the responsible use realm, so maybe a little less prevention, but making sure that those 21 and older are using responsibly, we have information in various forms on responsible use as well. I put this QR code here because we do have a new educational resource order form that's online. And on there, if you want any printed copies, everything's free to download. But if you want any free printed copies or bulk orders of some of our educational resources, we are happy to print those, ship those, and yeah, mail those to you. So please use our form, and I can share slides. But our form is online, and feel free to use that QR code as well in order to order some resources from us. I fully encourage it. Very briefly on our safe driving campaign, we did our first impaired driving survey in 2022 to help inform our campaign, which ran from 2022 up through 2024. We did various media platforms, so digital, online, billboards, TV, radio, you name it, we tried it. We also created a partnership toolkit, and I want to highlight this because this is still a resource that is available online on our safe driving page. It includes Spanish language if you need anything in Spanish. You can see the bottom two images are a couple of social media post examples, but the toolkit has social media posts, web banners, posters, flyers, and those are all free to use, free to download, and it is also segmented by audience. So we have a file of folders, or yeah, a file of folders for our state agency partners, community partners. There is messaging for colleges and universities, for cannabis businesses. And there's also one more group that is not coming to me off the top of my head, but there are plenty of audiences. And again, all the free resources in our toolkit are also in Spanish if you need those as well. And we are in the middle of a request for a proposal process to develop a new campaign. We're hoping to launch it by the end of this year. And so I will keep you all updated, and please check in with the CCA regarding our new campaign, maybe some new materials that are available, because we encourage you to join us in our messaging because we are not the only ones who are concerned about impaired driving, I'm sure. So please help us out if you need us to help spread a message as well regarding impaired driving or safe driving, please let me know. And that brings me into partnerships and outreach. So how can we work together? I would love to work with you. The CCA at large would love to work with you all in your initiatives and hard work. So we are involved in various work groups. Most are at the state level, but we do try to involve ourselves in just general substance use prevention work as well. We are happy to do presentations on various topics. Resource development and distribution. Like I said, we have free resources available on our website, but if there is a topic that you would love a resource for, let us know. We'll develop it. We're here for you. And then exhibit tables, if you're ever having a conference, workshop, let us know. We love to table. We love to distribute our resources. We would love to support your efforts. And like I said, in general, any projects or initiatives you all are a part of, if the CCA can help in any way, please reach out to me or the CCA at large, and we are happy to communicate further with you all. So with that, here are various ways to connect with us. We have all of our website information. I put my email in here as well as our data email if you have a specific data request. Um, and then, like I said, our full data reports are available under our reports tab. So with that, I will turn toward the chat and answer questions, concerns, perspectives to share.
Brianna, thank you so much for your time. Great presentation with tons of information. There was a question about data broken down by ages. It sounds like you can pull that information together if there's a request that comes in. So we just want to reiterate to reach back out to the Cannabis Control Authority to ask for those data subsets, and she can get that to you. Thank you so much, Brianna. And then I think there's a couple of questions specifically related to enforcement. As it relates to drug driving, how are we in the state of Virginia enforcing, doing testing for drug driving? And are there new ways and efforts to test for drug driving? And then the second one was related to enforcement around the cultivation in public spaces. How well is this enforced? It seems like there are places where they are more visible and without tags and have not been fined. And then the third question on enforcement was data regarding, do we have data regarding enforcements or fines that have been given? I know that was three different things. So it was
Yes.
enforcement regarding drug driving, enforcement as it as it pertains to cultivating in visible areas, and enforcement data on fines that have been uh, handed out.
Yeah. So I think I can answer kind of all three with one general statement, which is that enforcement, again, is going to be your state local police. And so the CCA does not have enforcement data on any of those topics. Virginia State Police, I think, would be the best source to get more detailed information. But when it comes to enforcing DUIs for cannabis, I know the state has looked into funding more drug recognition experts, and that those are state officers and local officers who are being trained to specifically identify what cannabis impaired driving looks like, what other drugged driving looks like. And so the state is investing more into identifying um, having police officers identify what that looks like on the roads, because there is no like breathalyzer for cannabis at the moment. I'm always like, you develop it first, you will be so rich. Um, but yeah, and then with the enforcement of plants and home cultivation, yeah, it can get pretty tricky to identify it. I feel like we always hear people say like, well, I can smell it still, or I can see it still. And like I said, that is a matter for your state local police to address. So that is not our enforcement. So state police might have some information on that in terms of any citations that have been issued, but it's tricky to say the least.
Thank you. And then the other question that came in regarded knowing if there's any information on the impact of secondhand smoke as it relates to cannabis use.
Yeah, there's some information, of course. Research is constantly emerging on it. In general, it can have some effects, just like secondhand tobacco use. We do have a fact sheet on secondhand smoke and potential risks when it comes to secondhand cannabis. And that fact sheet's on our website and available for bulk order as well. But we always encourage those who are using to not use it in front of children, not use it around others, because there can be um, some health effects.
Thank you so much, Brianna. Thanks for everyone who attended. Please come out and join us for our last training. Again, that's going to be on April 23rd at noon. I thank you for the time that you gave today. Have a great afternoon, and we'll see you next time.
Thank you, everyone.